Excellency, the COVID-19 pandemic hit Bangladesh like many other countries in early 2022. But due to the continuation of our long-standing activities in the health sector and the timely action of the government, we have been able to reduce the loss of human life and keep the economy running. We had to strike a judicious balance between saving lives and protecting the livelihoods. In parallel, our government rolled out a substantive stimulus package for industries and a comprehensive social protection portfolio for our low-income and marginalized people. We provided $27.96 billion as stimulus packages for industries and businessmen, the marginalized section of society like day laborers, rickshaw pullers, small traders, vendors, school and madrasa teachers, etc. About 78.5 million people benefited from the support during the COVID-19 pandemic. Besides, our party, Bangladesh Awami League leaders, workers, affluent people and businessmen extended support by providing food, medicine, etc. Due to our efforts, Bangladesh ranked among the top 5 countries in the world in overall COVID-19 management and recovery. We decided to procure and administer COVID-19 vaccines certified by the WHO as soon as possible. Despite some initial setbacks, we eventually managed to provide COVID-19 vaccination to more than 100% of our targeted population group entirely free of charge. A total of over 366.87 million doses were administered in 4 phases. I kept urging the international community to consider vaccine as a global public good and to make them available to low and middle income countries as a matter of priority. And I think you can take some initiative about it, and you will receive all my support on this ground. In Bangladesh, we are also in a position to contribute to vaccine research and production in a cost-effective manner. Among other policy support measures, I have already allocated a piece of land for setting up a state-of-the-art vaccine research institute. Our government extended support for our expatriates in different parts of the world by providing them food and cash assistance. We made special arrangements for repatriating our nationals stranded in other countries, especially in India and China. We also offered humanitarian support to a number of other countries in a spirit of solidarity, including by sending nurses to the Maldives to administer vaccines. We also vaccinated 1.2 million refugees from Myanmar sheltered in camps in Cox's Bazar. In parallel, we had to run an extensive awareness campaign to counter the indiscriminate spread of misinformation and disinformation, particularly through social media. Excellency, COVID-19 has been a global wake-up call, underscoring the critical need for comprehensive reform in international pandemic preparedness and response. This pandemic has shown us that we are all connected. None of us can be truly safe until we make sure everyone is safe. Now is the time to work together globally to achieve the public health goals outlined in Sustainable Development Goals 3 and Goal 17. This involves helping countries with fewer resources improve their ability to handle health risks. I thank the independent panel co-chaired by President Alan Johnson Sirleaf and yourself for making a compelling case about it. The lessons from COVID-19 emphasizes the need for a coordinated approach to pandemic preparedness and response, grounded in scientific evidence, global cooperation, and fairness and equity. A meaningful application of these lessons will be essential for mitigating the impact of future pandemics and safeguarding global health security. From our perspective, I would stress following. Number one, international cooperation and collaboration are essential for sharing information, expertise, resources to effectively respond to global health crises that respect no borders. Two, the race for vaccines revealed stark inequalities in access between developed and developing countries. Addressing these disparities requires concerted effort to ensure equitable distribution and access to vaccines, diagnostic and treatments. 3. COVID-19 highlighted the interconnectedness of human, animal, and environmental health. Adapting a One Health approach which considers the health of humans, animals, and ecosystems as interconnected can help prevent future pandemics. 4. The rapid development of COVID-19 vaccines demonstrated the importance of investing in research and development for pandemic preparedness. Continued investment in R&D for vaccines, therapeutics, and diagnostic is essential for combating the fatal infectious diseases. The COVID-19 pandemic in Bangladesh, as in other countries, was a test of resolve for preparedness, response, and resilience. COVID-19 showed that prior investment in health security in Bangladesh was very useful as the country was able to quickly leverage existing preparedness and response plans, surveillance platforms, laboratories, and workforce for emergency response. Our health system could rapidly expand the laboratory network for prompt diagnosis and provide accessible clinical care. Drawing on these lessons, we are now maximizing our efforts to prevent, detect, and better respond to future outbreaks and emergencies, including silent epidemics such as antimicrobial resistance. Political leadership's engagement and commitment are essential in driving systemic changes that can enhance our ability to prevent, detect, and respond to future pandemics effectively. High-level political leadership ensures that pandemic preparedness and response remain a priority on the national and international agenda. It facilitates the mobilization of financial resources, promotes collaboration between countries, and fosters innovation in public health systems towards achieving our shared commitment to universal health coverage by 2030. High-level political leadership is indispensable in driving reforms related to pandemic preparedness and response. It sets the tone for global cooperation, instills confidence in public health interventions, and ultimately saves lives. As we navigate the complexities of future pandemics, strong and decisive leadership will be essential in shaping a more resilient and prepared world. We must also mobilize collective political will and commitment to strengthen WHO's knowledge, technical and financial capacity for pandemic prevention and response by addressing the highly fragmented global health governance system. I can assure you that Bangladesh will continue to play a constructive role in these regards, considering its past success in protecting public health and dealing with the impact of the COVID-19 pandemic. I thank you, Excellency.